As to matters health and mental health care in Kenya has received a major boost following the launch of a Kenya mental health policy that seeks to ensure that those diagnosed with various mental disorders get access to comprehensive, integrated and high-quality mental health services at all levels of health care. The launch of the guidelines, that coincides with this year's commemoration of the World Suicide Prevention Day, also provides mental health literacy to health workers, which is crucial in the management of common mental disorders. Here is Gloria Milimu with this report.
The launch of clinical guidelines for the management of common mental disorders marks a significant milestone in addressing a condition that affects at least 1 in every 10 people in Kenya. The guidelines that focus on management of psychotic disorders, depression, bipolar disorder, anxiety disorders, post-traumatic stress disorder, mental health disorders in children, suicide and other psychiatric emergencies, among others, aim to close the treatment gap by providing evidence-based recommendations for assessment and management of various conditions seen in at least 25% of outpatients and 40% of inpatients.
By standardizing assessment and diagnostic procedures, the guidelines will help to reduce inconsistencies.
With the guidelines, I can be able to comfortably be mobile and just know that any part of Kenya that I'm in, as long as they need a service, there's a way I'm going to get it, and it's going to be a quality service.
And for you to get
For example, to address mental health disorders using psychosocial interventions, the guidelines seek to promote a sense of safety, calm, social connection, and hope. For depression, behavioral activation is recommended. For those diagnosed with depression or anxiety, relaxation training is suggested, while cognitive behavioral therapy is advised for depression, child mental health conditions, substance use disorders, and psychosis, among other interventions for various mental disorders.
It is a beacon guiding us towards better mental health outcomes for all Kenyans, including reducing the mortality gap that we are having between the people who have mental illness and those who don't have.
We cannot afford to ignore the mental health needs of any segment of our population. It is my brief that mental health should not be a medical issue, but a social and legislative priority.
Coinciding with World Suicide Prevention Day, the launch also seeks to eliminate barriers to treatment such as stigma and discrimination, which more often than not worsens the conditions of patients. Gloria Milimu, KTN.